Hi, Sharon.
Hi,
Um,
Waleed.
it's good to see you again. Yassine can't join us today. He's not feeling very well, so he's going to be the first person to see this recording. Um, but I'm kind of excited. The first time we talked about the ability to see clearly and clear diagnosis. And the second time we talked about the pivot conversations, which cleared up a lot of stuff for me personally. Um, and where we ended was sort of understanding how the conformations help us to see the patterns that are going on in the body or the mind. We had a fascinating discussion about the emotions. Um, and the end point was we were going to discuss some cases. Um, and I'm really looking forward to that because I find that these cases are like really, I find them extremely fascinating. And I think they're a really good way to learn. So I'm looking forward to that. Okay. So we were going to discuss some pivot cases. Would you like to, and one in-depth case that looks at your process with diagnosis? Which would you like
Mhm.
to start with, the pivot cases or the diagnosis?
Well, I want to talk about some principles of clinic work first, and kind of through exemplifying those principles through talking about a couple of cases, um, and then go into one case in depth. And the principle that I'd like to talk about is the idea, I guess, two principles. One is going with the flow of reality, going in the direction of flow of reality. And, you know, we learn a lot of things about diagnosis, like this is this and that is that. And, constipation can be from A, B, C, D or something like that. But in clinical reality, the patient comes in the door and we're immediately gathering information, based on visual diagnosis, what we're hearing, and then the questions we ask, what we feel with our hands on the pulse or the abdomen. And so the direction of flow is that initially we're gathering information. Some of it is even information of what's my sense of things or what's my experience of this person, and how is it that we connect with each other. We're getting all kinds of information that may be um, not even things we articulate. So there's this direction of flow, and then there's the question of what do we do with that information. We have to take all this miasma of information, like tons of information, and we have to hone it down to something we can articulate, even if what we're articulating is, oh, this is a Bancha tongue pattern. It's kind of unbelievable that we have to take something that's so vast, these signs and symptoms and information, and we have to come down to something that's like 6 or 8 herbs, to address this complete person, And so there, it has to be winnowed, right? All that information has to be winnowed. And so, what do we do with that information is a really big question. And that's what I want to kind of demonstrate what I do in a particular case. But one thing that really gets us into trouble is when we go against the direction of flow, which to me is like just taking principles and applying them to a complex person so as to kind of come to a diagnosis that makes us feel comfortable, because like, oh, I'm applying a principle onto this person, and it may be that it doesn't fit entirely, like there are lots of things that don't fit with that, but it makes me feel good because I'm applying a principle to it, and it makes me feel like I know what's going on and I can do something. So instead of allowing the diagnosis to kind of completely reveal itself, in my philosophy, the diagnosis will reveal itself. We instead start taking truisms and applying them to signs, symptoms, diseases, our patients, before we actually see what's going on. And we also, we talked about this in the last podcast, which is about red herrings, and truisms and red herrings go together, where we see something like one example is that, I learned about diabetes from these textbooks, and what I learned was that diabetes was this deep yin deficiency, kidney yin deficiency. And a lot of times the type 1 diabetes with, great thirst and incessant peeing, great hunger, was applied to type 2 diabetes. And it was just sort of a knee-jerk reaction. Like, if someone has diabetes, they have kidney yin deficiency with empty heat. Alternatively, maybe they have spleen deficiency because it's diabetes and your pancreas has stopped working, and therefore it's got to involve the spleen, right? And so one thing I learned through diagnosing based on what I know for sure, a huge benefit of doing that is that you learn so much about what diabetes is, because you're looking at the actual patient, what's actually going on with them, the signs and symptoms you see, and then you have a diagnosis, and then you see, well, how do I understand diabetes now that I see what's actually going on? So instead of superimposing pre-existing patterns to a disease, you're looking at your actual patient. And like what I discovered through actually diagnosing my type 2 diabetes patients was that it almost always involves systemic blood stasis, where all of the blood in the body is viscous and not flowing well. And I learned that simply from actually diagnosing my patients instead of going to the book, right? Then I also learned that, and this has been so helpful over the years, that that this thick blood can cause accumulation of flesh. Thick blood can cause accumulation of flesh. So the idea that in type 2 diabetes, people are often obese, and that must be spleen damp, right? Not true. It's not true. A lot of these patients are not spleen damp, and so then I have to go and think, well, what I know is that there's this really viscous blood. I can tell from the signs and symptoms. Now, how do I understand the obesity based on that? So I start to really understand pathophysiology in a much deeper way than I could have if I just jumped to all these conclusions. And my treatments are much more effective because I'm treating them based on what's actually going on. So that's just a little bit about the benefit of diagnosing yourself. And so one case example I'm going to give that's not pivot related is a patient who came to me with chronic boils from staph infection. And, she came to me, she had these red boils with a white pussy head to them. And she had gone on several courses of antibiotics, and they would go away and then come back again. And so, of course, you can imagine that there's a lot of conclusions you could just jump to. She's got infections, it's fire toxin. I'm going to give her Huanglian Jiedusan or something like that, something to get rid of this damp heat toxin in her skin. And I saw this patient a long time ago, and she really stuck in my mind because it was at a time when I had just come back from Nanjing, where I studied with Dr. Hong Hong. And I was, I came back really committed to treating the pattern and not the disease, and understanding the disease on the basis of the pattern. So I even more committed to that than I had been. So my self induced exercise was to forget that she had staph infection and boils. And how would I diagnose her if I didn't know that she had staph infection and boils? And she was very thin, very pale, sallow, very cold. She had very painful menstruation, that she craved warmth when she was menstruating, with dark blood. And so basically, outside of these staph infections, she was a Wenjing Tong pattern. I gave her warm the menses decoction. So then, I'm thinking about the boils and the way that the Wenjing Tong works in the body, and thinking, how can I explain the fact that she has boils, chronic boils, with the Wenjing Tong pattern? And for me, that was easy. Like her resources on the interior, she's, very cold, and her blood was very deficient. So when I started warming up her blood and nourishing her blood, and that blood can then go to the surface of her body. Well, that's part of her immune system, isn't it? Like being able to have those inner resources go to the surface of the body, where we resolve issues that are stuck in our skin. She was so cold that ability to resolve her surface, she didn't have the blood or the yang in order to do that. And so that it really struck me that the formula was sort of immediately effective, in that the current boils that she had went away, and then they didn't return. And she got warmer, and her menses became, really relatively painless. And, so that is an example of really basing the diagnosis on the complete pattern. And so something like a boils and a staph infection, red herring, right? It happens all the time. Like I have a patient now who I diagnosed with it was actually kind of Wenjing Tong, Mai Mendong Tong, and Mai Mendong Tong is within Wenjing Tong. It's Wenjing Tong is made up partly of most of Mai Mendong Tong. And so she had lung willed, and she had chronic lung infections, and she had been given, bitter cold anti-infection herbs from another practitioner. And to me, like, oh my God, she's cold and dry, and her lungs are like a dried up leaf on a plant, And so Mai Mendong Tong sort of waters, it just kind of, nebulizes steam to moisten the lungs. And, and it was, the other herbs were not being effective. I mean, I'm thinking maybe they could even hurt her, but there wasn't evidence that they had hurt her, but they weren't being effective. But the Mai Mendong Tong, just strengthening her lungs and making them more vital, she's been able to not get these infections. Anyway, I think it shows like how infections, there's all kinds of things that can be red herrings. And so, it's part of what I teach, what I do is like, how do we base a diagnosis on what's actually there? Yeah, go ahead. You have a question.
Yeah, it's just interesting because I think it relates to something that we talked about last time. We were talking about the you know, we were talking about the Shaoyang pivoting, and you said, and we were talking about Chao Chai Hutang having a lot of Tai Yin stuff in it. And you kind of you were like, you know, you could not have enough heat for the Tai Yin to do its job because there isn't enough heat, or you could have no heat for the Tai Yin to do its job because the heat is in the wrong place, or it's blocked, you said, I
Yes.
think, specifically.
Yes.
With this Wenjin Tang thing, you know, trying to carry that thought process over to this, I immediately kind of start thinking of a question that I think I wouldn't have had before, which is the Wenjin Tang then, is she cold because she doesn't have enough yang, or is she sort of cold because she's got that yang, but it's not moving up to the surface? You know what I mean? Like, which one is it? Which one does Wenjing Tang sort of help with?
Yeah. So with Wenjing Tong, there's not enough yang, and there's not enough yang in the blood. And there's not enough blood either. There's not enough blood fluid. So it enriches the blood fluid and strengthens the yang within the blood with pungent warmth. And pungent warmth is what moves blood up and out. You know, also Guizhitong is inside of Wenjingtong. You know, so Wenjingtong nourishes the blood, increases the warmth in the blood, and that's what moves everything to the surface of the body. You know, is that Guizhi and Wujuyu bring that warmth all the way to the surface of the body. So it's not enough of the warmth with Wenjingtong. Yeah.
And then with the second case, you use this word, which I find really interesting, nebulizes, right? So again,
Yep.
the kind of question, is it that you're introducing moisture and heat and the ability to kind of diffuse that up to the lungs? Or is it that there's maybe heat or maybe moisture that's like locked in the body that you're sort of spreading?
Yeah.
Which one would
So with Maimendong Tong and Wenjing Tong as well, there's not enough fluid, but you could just add fluid, but it wouldn't, you know, and a lot of like lung yin deficiency formulas have all these yin tonics. They're not as effective as Maimendong Tong because Zhang Zhongjing understood about working with the life force and that the life force is yang. And so Maimendong Tong includes Ban Xia, which is pungent and bitter and warm. And the function of the herb Ban Xia in Maimendong Tong isn't because there's also some phlegm, you know, like people will say, oh, there's dryness, but there also must be some phlegm. Otherwise, why would they use Ban Xia? You know, but that's not why Ban Xia's in there. Zhang Zhongjing always uses yang in order to generate yin in yin dryness patterns. You know, so whenever, whether it's Shen Qiwan, which is, I think, a kidney yin tonic formula, or Wenjing Tong, Maimendong Tong, Xiaozhenzhong Tong, Zhang Zhengjing uses warm or hot herbs with the moistening herbs to create physiological fluids, which are nebulized fluids, right? For those fluids to be spread throughout the body and transformed, it has to have some yang in order to do that. You know, otherwise you just give all these yin tonics and they kind of just sit there, you know, and
right.
they don't, like, life is always moving and transforming. So that's, I think, some of the genius of Zhang Dongjing and of the classical perspective is using yang in order to transform yin.
Which,
So
correct me if I'm wrong, but that I mean that just makes sense with the basic like idea of what yin and yang are, right? One is moving and one is kind of inert, right? One is functional and one is
yeah,
substance, and one is, and so you can't really just put a whole bunch of yin in because that's not.
yeah. And you know, I told you I was in Chicago last weekend teaching, and the topic was, you know, treating the life force. and why we have this eye to yang, those of us who practice with classical formulas and with classical principles, even if we're not using classical formulas, that there's this eye towards the yang, because it's almost like our secret power, our magic wand, like we do take into account yin, both, the quality and quantity of yin, but what do we use in order to increase it, in order to move it, in order to transform it? It's a yang, so we're like, where do we want to bring the life force in order to create transformation, so
Okay.
yeah. And I wanted to mention one other case before I bring up a PowerPoint to go into a case more in depth,
Mhm.
which is a recent case of mine that just really struck me, because this is somebody with post-COVID syndrome. So post-COVID syndrome can bring up all kinds of like red herrings, right? Or even like, how do you treat post-COVID? What do you do? And this particular person is 16, and he had a vaccine, and then he lost his head hair from the vaccine. And then it was finally starting to grow back, and then he got COVID, and he lost his hair again and his eyebrows as well, and it wasn't growing back. And so, how do you treat post-COVID? I don't know how you treat post-COVID, but he saw somebody who said, oh, lack of hair growth, it must be that his blood got really damaged. And so he was given a formula to really enrich blood, because the hair is the sprout of the blood, right? And so that's a truism that can also be like a red herring. Like, that's true, but lots of things can affect the hair, but it's not true. Like, if the hair is the sprout of the blood, does that mean if your hair is damaged, there's something wrong with your blood? Like, that's going the wrong direction, right? It's not necessarily going back the other way. If the hair is the sprout of blood, sure, but does that mean all hair problems are a blood problem? So he took a lot of blood tonics, didn't have an effect. And so then he came to me, then he came to me, but I have to say, I'm sure it's happened the other way around, where I didn't treat someone right, and then they went to somebody else and got it right, and so, but of course the fun ones to share are the ones where I got it right. But I have to be humble and say it doesn't always happen that way.
Right.
But it did in this case. So and I think it was the strength of this kind of clear diagnosis which helped, which was, what I ended up seeing with him was that there was a lot of stasis, especially in the form of blocked emotions, and that he had a hard time expressing himself in general. And then he felt a lot of irritability and anger. He's young, his body is strong. So I don't think it's a deficiency, right? And so there isn't a lot to go on. Like, he's healthy in a lot of ways, his stool, his urine, sleep. But, so I have to go on what I have to go on, which is, well, his emotions are stuck, and he's got anger, which for me is wood, and it's not wood deficiency. So I'm right there in the pivot, aren't I? And so, um, and his pulses were wiry, but also superficial, like floating up into the Tsun positions. So what formula did I give him? I gave him Chaihu Jalongu Muli Tang, which is going to open up wood so wood can circulate and also help the yang go down. That's been going upward. So then he lives, actually, they came from far away, 3-hour drive. And so they just are able to order herbs in New York City. And so they're like, right within a week, his hair is growing back, and he feels like this sense of ease and peacefulness, and so, that's another, just an example of, the red herrings, like post-COVID. Oh, it must be a virus that's stuck in his body or
Right.
something like that, and then also lack of hair growth. Oh, must be blood deficiency. And
Mm-hmm.
so I think what I want to really put across in this podcast is just, you know, being able to know what to do with signs and symptoms in order to see a pattern clearly is really important for effective treatment. And, there's all kinds of information, and, we can emphasize information. Some people emphasize tongue or abdomen or pulse, signs and symptoms. We have a lot, and they're all guiding us to the pattern. If we know how to read them.
I find that really satisfying also as a patient. I mean, my own problems with ill health, the thing that turned me on to any alternative system of medicine is I got really sick in my early 20s. I was yeah, and the doctors and all the symptoms came basically at the same time. And the doctors that I went to just a priori could not sort of like conceive of the problem as a problem. They just were like, this is a problem for your gastroenterologist. This is your problem for your like urologist. This is your problem. Those things have nothing to do with each other. And I was like, the odds of all these things appearing in the same like month are astronomical. You have to see that all of these things are somehow connected with each other.
Right,
But when I started looking at the TCM, in theory, that was the case. But like this case that you just said, it's like, it's not just like that they're red herrings, they're also red herrings that are often swimming in different directions, right? Like
right.
a
Or they
deficiency,
seem
or
to
is it a
be,
virus, or is it, those are different things. So to be able
right,
to have a thought that brings those together, but it's one body, right? So I don't know. It's very satisfying.
exactly.
Yeah.
Yeah, yeah, it really is. And as a practitioner, it's really satisfying, I mean, it's always satisfying to get good results, but to be able to have a patient come in and be able to really see what's going on and have a sense like I know what to apply here, and I know why. I can articulate what I'm doing, which I'll bring up this case now if that's okay. And sort of go through. It's a complex case, and let's see. And so in these complex cases, we have so much information. So it sort of is a good indication of how you take a lot of information and winnow it down to what you really need in order to do something with clarity. So this is also a young 16-year-old, and he came to me with the diagnosis of epididymitis, which is inflammation of the tubes going between the scrotum and the penis. And um, and so he was in a lot of pain. So he was 16 when he came for his first visit. He was in his first semester of his senior year in high school. He appeared healthy and strong with a rosy complexion and bright eyes. He described himself as an athlete and was preparing to go to college the next year. I observed that his lips were very chapped. His mother described him as emotionally tense, struggling with some learning issues, has made him self-conscious, and has caused him to push himself hard academically. I could also observe this tension. Starting at the end of his junior year in high school, Frank began to have severe scrotal pain. He stopped being able to do sports at all and began missing school due to pain. He was diagnosed with epididymitis. This is an inflammation of the tubes that go from the scrotum to the penis. He was given a salt flush and was told to masturbate after drinking it. This treatment made the pain worse. So this is kind of the idea that it's this excess blockage, and so we have to push it out. And so it was useful to me to know that this made it worse, that it's not a blockage that needs to be removed. He was then given painkillers to manage the pain, and these were not very helpful. During the intake, he described his medical history. At age 13, he had suffered from a severe case of mononucleosis. This manifested with a very sore throat, swollen glands, and a high fever. Even after the fever abated, he was left with strong fatigue that took months to recover from. Soon after that, he was diagnosed with sclerosing cholangitis. This is inflammation and damage to the bile duct system, which is associated with ulcerative colitis, which he was also diagnosed with. It's actually the tube that goes from the bile duct to the liver. It can lead to cirrhosis of the liver and cholangitis, and liver failure, and an increased risk of gallbladder and colon cancer. So interesting, another small tube was inflamed, right? To me, that was interesting. As well as just the tube of his intestine also had some inflammation. He was asymptomatic for the sclerosing cholangitis, except for some left side, that should say right side subcostal tenderness, but his bowels became explosively loose, which led to the diagnosis of ulcerative colitis. He was given prednisone and then managed this with other medications. At the time of our visit, his stool was loose, but his ulcerative colitis was considered managed. So that's kind of his history and Western medical things, which, is overwhelming as a practitioner. Like, I don't know how to treat epididymitis. I don't know how to treat ulcerative colitis, but that's really important to acknowledge, because we don't treat those things, we treat the pattern. I do know how to treat patterns. So I go with what I know how to do. And so I need signs and symptoms. So Frank had strong pain in his scrotal area that was worse with vigorous exercise and with stress. When questioned further about the vigorous exercise, we determined that this was related to sweating, not movement and not fatigue. Because we have some kind of truisms in diagnosis too, like worse with exercise deficiency. That's an easy thing to do. And we always have to ask a little more. What is it about the exercise? And it was clear that when he sweat, his symptoms would get worse. So loss of fluid made it worse. He felt better if he drank more, but also felt that water went right through him. He was thirsty for cool or cold beverages and drank a lot. This is really important to me, that he is thirsty for cold beverages and he drinks and it goes right through him. So that means he's not absorbing fluids. His urination was frequent with a feeling that, oops, I just read that. He also noted that he felt hesitation upon urination. He said his muscles were generally very tight, and though he stretched a lot, it didn't seem to help. This was over his whole body. His tongue was slightly red, but otherwise a normal size. The moss was slightly dry. Oops. His pulses were wiry, especially in the guan positions. His abdomen was healthy except for tightness of the rectus that spread into the subcostal areas. So this is me gathering lots of information about him. So this is just to kind of go on a side trip. Bu Li is like non-beneficial urination, and to Li is to benefit. And so Bu Li will often be translated as inhibited urination, but it really just means unbeneficial urination. And his urination was truly unbeneficial. Like he he peed out too much, but he also failed to pee. He had some inhibited urination, which to me means that some water is being blocked and accumulated in his lower body, which is an important part of why he has this pain. So this is me going over what I do with the symptoms. And what I do with them is I look at them for what they tell me for sure, individually, unless it is a subcategory of another symptom. So he's got a robust body, so it's not going to be a strong deficiency pattern, not going to be pure deficiency pattern. Pain in the scrotal area, what does that tell me? Stasis in the scrotal area. And it's worse with purging, which means it's not a blockage in the tube. It's worse with stress, which for me, I say, oh, it's wood related. I know that for sure. It's worse with sweating. So loss of fluid related stasis in the scrotal area. Like I know that that pain is related to loss of fluid, and better with drinking tells me the same thing. So he's got a loose stool. All that tells me is his stool is not formed. I don't know why. I just leave it at that. Dry lips means he's got dryness in his stomach. And he's got thirst for cold beverages, which is heat in the stomach. And frequent urination, just, oh, it's coming out too much. But it's inhibited, so I know there's some damp accumulation in the lower jowl. He's got really tight muscles, so his muscles are not nourished in the sense, nourished here means with fluids. They're not nourished with fluids. He's got emotional tension. Emotionally, he feels tense. So I say that's wood tension. So just keeping it really simple. Looking at, I say, want to look at symptoms for what they are. They might not be what we think they mean, but we can always know what they are. So a red tongue is heat, dryness is some fluid damage, the rectus tension is blood deficiency, and the subcostal tension is wood involvement. So what do we know? We know he's got a strong body. He's got deficient fluids and deficient blood. He's got some wood stasis with blood deficiency. He's got a hot stomach with dry spleen. His muscles are not nourished, and he's got some damp in his lower jowl. So this is kind of what I'm saying, that the diagnosis reveals itself. And this is something I work hard to teach my students. Like, we want the diagnosis to reveal itself. Like, it's not something we have to figure out. If we're working too hard to figure it out, we're not seeing what is being shown to us through the body. So is it excess or deficiency or both? Which one is primary? And I would say about equal. Like, he's got a robust body, he's young, but he's also like had his fluid and blood damaged. And what are the organs involved? The stomach / spleen, we could say, and the liver. And what aspects? Stomach heat with fluid damage, liver blood deficiency and chi stasis, and lower jowl water accumulation. A question to ask: if there's dampness, what's the root of the dampness and where is it? And there's damp accumulated below in the lower jowl, and it's there because he's not absorbing the water. So it's kind of like he's dry like a desert, and when it rains in the desert, the water just pours through without being absorbed, and it pools. It goes out, but it also pools. So in terms of zongfu, blood, fluids, liver blood deficiency, liver chi stasis, stomach heat, or it's kind of like the stomach is hot and the earth is dry, is how we see that. The muscles are undernourished, which the muscles are ruled by the liver blood. So that's a blood deficiency failing to nourish the muscles. And there's water accumulation in the lower body. So looking at this, let's see, let me go back. Looking at this sort of in pictures, and if we could kind of think about superimposing yin yang onto this, but we can see like this, the digestive system is dry. So he drinks water and it goes right through him and accumulates down below. He's got blood deficiency, and which I put over on the left because that's where the blood rises in terms of rising in the east, which is on the left. And he's got this liver cholestasis that's not deficient. So that we would call a pivot block. And he's got tight, undernourished muscles. So for me, the treatment starts to become obvious, from this. We have to open the pivot. We have to nourish blood in order to soften the muscles, right? In order to nourish the muscles so that they're softer. And we have to help the earth get moisture, and we have to increase the absorptive capacity of the earth so that water doesn't accumulate. Instead, it gets absorbed into the flesh and muscles. And we have to help the water leave a little bit that's accumulating. Now, when we look at this and we know, I see what I need to do, how can we explain the scrotal pain with this diagnosis? To me, it's not hard because we've got the pivot block, and the pivot block will create symptoms in pivot areas, which are the groin, which is the subcostal region, which is where is cholangitis manifested. And then also we can see that the muscles are tight, and that's also wood. And so that tension they're tight and dry. So that brittleness of the muscles creates more stasis, especially in pivot areas because of the pivot block. So in my thinking, I'm thinking, well, if I open up the pivot, I help absorb fluids so they can drain properly and moisten the muscles so that there's this general moistening and relaxation, then the flow in the groin will be much more eased. So we can see that in yin yang, where the yang is trying to go down, but it's getting blocked in the pivot area. And so there's some heat even developing. I think for him, it also came when he had the high fever, it damaged his fluids and he never really recovered. Plus the pivot block created more heat that further damaged the fluids. And so there more heat developed until it just dried him even more. So the earth being dry leads to this thirst for cold beverages and dry lips. Like you could just see the dryness of his earth by looking at his lips. So I'm going to just skip over that.
Was that the loop-de-loop?
I won't go into that. So
Okay.
we know that this is, diagnosing. We know it's not Taiyang. It's slightly Yang Ming. Like his Yang Ming is very dry, right? And he's a robust person with heat stasis in pivot areas. He's got dry earth, unable to absorb fluid and blood dryness. So we could say these conformations are all affected, these great sweeping motions. So I kind of already did this, but we can go back now once we have a diagnosis and explain his symptoms. You know, why is it worse with purging? Well, purging made him lose even more fluids. Worse with sweating. Oh, he's losing more fluids. You know, we can understand things now that we have a diagnosis, and the scrotal pain makes sense. So some potential things we could misdiagnose, and we could just say, oh, he's got liver chi stasis causing pain. And we might move the chi and move the blood, you know, which would be wrong, right? But we could make a case for it, like blood stasis leading to pain. It's an itis, and that means it's heat. I'm going to just go in and clear heat. Already we saw it's a block that needs purging, might be something, which we already saw wasn't right. And it's just pure damp accumulation, and we could give something like Wulingzon or something like that, which would not be right. So it's easy to overlook the water metabolism, the tight muscles, and the dryness. I think those are things that, with our sort of basic TCM education, those would be things we might overlook, like the relationship between this thirst for cold water and the peeing too much. We might not even ask, do you feel generally tight? And yeah, that dryness aspect. So what needs to happen? We have to clear that Yangming heat, but in a way that cools and absorbs fluids, right? And when we absorb them into earth, it goes into the flesh and it softens the flesh. We also need to have those fluids go into the blood so that the muscles relax. You have to unblock the pivot to clear heat. We already talked about these other things, and all of this is to open the flow of cool, enriched fluids into the muscles and sinews so everything relaxes. So that's what we did with him. And I'm going to go through this quickly. Sorry. So this was the formula that I gave him. It was Sinisan, right? Because Sinisan unblocks the pivot and nourishes the blood. It includes Xiaoyao Gansao Tong, which relaxes the muscles. But of course, Sinisan by itself doesn't address the failure to absorb fluids into the digestion. So I also add the chalky, cool Tianhuafen, which is exactly for this. Thirst with really stiff muscles. They're stiff because of that heat. Tianhuafen is beautiful for that. And Gugan does the same thing as Tianhuafen. It stops thirst, it relaxes muscles, you know, by bringing nice fluids into the muscles, absorbing it into the muscles. But Gugan also helps to stop diarrhea. So it's fantastic also for his colitis, his Crohn's disease, ulcerative colitis, I'm sorry. And of course, fooling to make sure that the water is passing out well. So whatever water is accumulated has a way out, but mostly fooling will also help absorb all the Gugan, fooling, Tianhuafen are chalky. So they help the absorptive function of earth. And then I added Yan Husuo Chuanlianza just for pain, because pain was his main, I think. So they're both cooling. Chuanlianza is a Shaoyang pain herb. So, taking this whole complex thing with all these red herrings, filled with red herrings, and trying to see through it clearly to the essence of the pattern, And then we come down to a fairly succinct formula and to treat him. And this just helped. It took a few months for him to be completely well. And then we had, I'd see him like once every month and a half just to make sure we're continuing and he's not falling back into bad things. But this worked really well, and he was able to complete his senior year, go back to school, and go to college. He was afraid he wouldn't even be able to go away because he really couldn't function because he was in pain so much. And he could resume his fantastic career in ultimate frisbee. So, yeah, a quote, a few observation and much reasoning lead to error, but many observations with just a little reasoning, with the key reasoning, what's the key reasoning, can lead to truth. So that is my case to kind of illustrate my process, and this is what I love to teach as well. And I think that it's kind of missing in most education. Even you learn about classical formulas, you learn all kinds of fancy things, but at the same time, like this basic of what do I do with all these signs and symptoms? How do I avoid the pitfalls? I think is a gap that I'm trying to fill.
Yeah, I like to take advantage of this moment because there's a lot of like I talk to a lot of practitioners and they're very careful because they don't want to sort of just be like rude, I guess. But I'm not really in the practitioner community, so yeah, I as a patient, I would say there's a lot of good TCM practitioners, but I feel like they did it themselves. I feel like it's not a thing that's systematically sort of taught or presented in a kind of coherent, systematic way that's like transferred.
I think really good doctors do this intuitively. I think that there's an intuitive, and I translate and give my students a lot of case studies, and you see that this is what the doctors are doing. They're weeding through the, all the stuff that's there to the key things that they need, and seeing and not jumping to conclusions. And for some practitioners, it's really intuitive, but for a lot of practitioners, it's not. So I think like deconstructing the process that's kind of almost unconscious and it's so intuitive for a lot of practitioners, it's important to deconstruct it so that it's available for people who it's not intuitive for. And then they can practice and develop it as a skill.
I have a couple of like specific questions. I think I've still got maybe 10 minutes with you, if you don't mind. A lot of these things, as I was kind of like writing down notes, you then answered them as we were going, right? And some of them were really interesting. This thing about water, right? The water's coming out, the water is also stuck, which sound like two things that what's going on. But I noticed a couple of really interesting things. I noticed that you drew conclusions. I'm trying to find out what the notes that I wrote now, but you like on that list of things where you were like, these symptoms are what they are, these symptoms we can draw like a one-step conclusion from, right? Like all the kind of scrotal pain or whatever, not sort of not kidney stuff, not liver stuff, not, you're just like, there's a lot of weirdness going on in that area. But then in the next step, you're like, but he's also got a lot of stress and it gets worse with stress. And so now we know there's liver stuff involved, right?
Right.
Yeah,
I would say wood.
Yeah, you said wood.
Then we don't know, is it excess wood kind of pivot problem or deficiency wood, blood deficiency?
Right.
It was both, right?
Yeah.
And which is what Sunny-san is for.
Right. And I guess that leads kind of into my other question, which is that on the one hand, we've said, and I've heard this before, I think I heard it from Laurie Ayres. He's like, no, it was from somebody else, but he was another classical medicine practitioner. He was like, this person is not deficient. This person is like young and strong and well fed and everything is fine. This person is not deficient. But then we did start talking about deficiency later, right?
Right.
So there, on the one hand, some of it is kind of obvious to me, like you can have a blood deficiency, but not an overall deficiency. But then we also talked about like the earth being dry. And so I'm wondering, where does that dryness come from? Is that not a deficiency of the earth?
It is. It's a deficiency of the damp of the spleen, right?
Right.
The spleen has actually been toasted, you know? And so that's what makes it not absorptive like a desert, you know? And it is a deficiency. And, in TCM, we have something called stomach yin deficiency. But really, the Fu organs are hollow, right? And so, in that way, they technically can't be deficient, right? Because their pathology is about being blocked. And so, another way of saying stomach yin deficiency is to say dry earth. And that would be kind of the spleen aspect. But it's actually kind of at the epigastric area, like at the stomach station almost of the terrain of earth is very dry. And so it is a deficiency
Right.
of fluids. And also it's dry, and the heat aspect is more related to the stomach, So it's really sort of dry, hot earth. And it is a deficiency. So it's a robust young person with damage to his earth fluids, right?
So what if you looked at a person and you're like, this person is not robust and they're not young and so they're deficient in another way, what would you mean? Like what would you consider to be that other kind of deficiency where you just look at a person and you're like, there's a lot of deficiency going on?
They're so deficient. Well, we're looking at like deficiency and excess are not mutually exclusive, right? We can have some aspects that are excess, some aspects that are deficient, but we're always looking at the constitution of the patient and seeing, oh, it's a deficient constitution. A deficient constitution can have a blockage too, right? And a robust person can have some damage that left them deficient. And so, we're looking for in what ways are they deficient, in what ways are they not deficient, And so we're just looking at both, and we have to put that together in our final diagnosis. A question I asked, like you saw, was, what proportion? And I think it's always good to think about that. Like, oh, it's 100% deficiency. That's 100% deficiency, or 100% excess, and, or like, I think that's an important thing to sort of weigh out for ourselves, based on signs and symptoms and our general impression of people.
Do you modify on the basis of that sense? Like, do you say, oh, he's very deficient, more, or his muscles are really dry, more Guggen, or, in terms of the dosage, I mean, as opposed to.
Of course.
Okay.
I think that's what Zhang Zhongjing was training us to do. Like he has Guizhitang, Guizhizhang Gugantang. He has, So, Gualo Guizhitang, which is Tianhua Fan with Guizhi, which is for when the muscles are really stiff. It's called for soft tetany.
Yeah, but what I'm asking about, I think, is the amount of the specific herb. That too.
Of course, yeah. Yep.
Okay, one last question. It's interesting to me, this thing that you were talking about, and I've heard you talk about it before, this kind of chalky herb thing. And it's a question that I have about like herbalism in general, I think, this idea that an herb is regulating something, as opposed to we're regulating something. So there's an herb that, you know, is diuretic, so it increases the release of fluid, or there's an herb that kind of helps retain fluids. There's this kind of third idea of an herb regulating the body's release or retention of fluid sort of almost on its own. And I
Yeah,
wanted to ask you about
I
that.
wouldn't really see it that way. So let's take Fuling, for example. You know, Fuling is chalky, and so it increases the absorptive capacity of especially the spleen, but also to some extent the kidneys. So Fuling is absorptive, but what does that mean? It means that it changes the quality of the tissue so that it's able to absorb better. And what's true, just like in soil, soil that absorbs better drains better, right? So it's not that it regulates, it's just a fact that when you change the quality of earth, soil to be more, you know, like peat moss, more absorptive, it will drain better. And when it is like sand or like clay, it doesn't drain. It doesn't absorb, it doesn't drain, both. So they're not separate functions. The same is true with an herb like baishao. Baishao can be used to treat constipation or diarrhea. And what baishao does, when you nourish the muscles function better. So there you get not so much spasticity like in IBS where your intestines are all spastic, and you get better peristalsis. You know, so the muscles just function more like muscles. It isn't that baishao just relaxes everything and makes it flaccid. It nourishes muscles so muscles can do their job, which is to contract rhythmically at the right time and not at the wrong time, right?
It's not,
So we could say that it regulates, right?
yeah,
But it's really one thing that it's doing, just like Fuling, it's one thing that Fuling is doing.
right. It's not the herb immediately to the function. It's it's the body that regulates, and so the herb is actually supporting the body.
Yeah, so we don't want to say Fuling drains damp and supplements earth. Fuling changes earth so that it absorbs and drains better.
Right.
It's one thing,
Right.
right? Yeah.
I wanted to save this to the end. We started with a sort of a thing from the Islamic herbalism tradition, and this is not a thing I was thinking about before, but I'm really fascinated by that last slide about observation, right? So a lot of observation and a little thinking, or a little observation and a lot of thinking. And there's a Sufi saying that I think kind of helps us wrap up all this talk about diagnosis in the same way. It's reason. It goes, reason is the best servant and the worst master, right?
Exactly.
And it's like a tool, and you don't want to overuse it. You know, it's not for things that's
Exactly.
not its job, I think.
Right. You want to, I think Einstein said, you want to make everything as simple as possible, but
Right.
not too simple,
Yeah. Yeah.
you know?
Yeah. Yeah. Right.
Yeah, and in a way, like my students, you know, come to the program sort of really trained to make things much more complicated than they need to be, with a lot of reasoning,
Yeah.
you know, and so how do we don't want to exclude any of reality. We have to take all the signs and symptoms and history into account, but the reasoning has to be clear and simple. Yeah, it's
How long?
actually much easier to diagnose than we make it, you
Yeah.
know.
Yeah, that's what Avicenna used to say. It's, which I'm beginning to understand more and more the more I talk to like, I think a certain type of practitioner. He always said this thing I thought was really interesting. He said, I found philosophy really difficult, but medicine is actually very simple. And I thought,
Mm,
I used to think that can't possibly be right, but I mean, listening to you now, I'm like, oh, he meant that technically. He meant like there's actually a very simple process that you need to follow with the body,
yes,
you know?
right,
Awesome.
right. I think that's right.
How long do you think that takes? Like people come into your program and they're trained one way, and then they have to, I suppose, reorient how they think things through. How long does that process take in your experience?
It varies a lot,
Yeah.
with different individuals.
Yeah.
People have different habits of mind, and you know, so
Yeah.
it's really, in a way, it's a process of, once you recognize and realize the lack of usefulness of these habits, what's left is clear diagnosis. It's like a process of clearing out wrong thinking. And what you're left with is clear diagnosis. So it's not even a method, right? It's just looking at reality. Like once you clear away the bad habits, you can see it's clear,
Hmm.
so it's a really interesting process to support people through, to and there's always a tendency to come back to the old way of thinking, and
Right.
okay, let's keep working at it. Can you see the mistake? Can you see where it led you,
Right.
and how it flummoxed your clarity? Yeah.
I'm gonna ask you to stick around for just a minute after I stop recording, but before I stop recording, I want to go on public record that I've really enjoyed these conversations and I've really learned a lot. And that was just in, a couple of hours. And so, having 2 years to go through these things, I think would be just really, really beneficial and just fun. Just I think a lot of fun.
I think it is. Yeah.
And so I hope that anybody who's listening, I'm a big fan of learning. So part of why we're doing this is to give people all the avenues for learning. And I hope it gets to a lot of people. So thank you. Thank you for taking the time. It's
I
been
really appreciate the opportunity to talk about my passion.